Hello, everyone, and welcome to Pepito Live Costa Rica. Welcome to this show today. We have a very special show, a very special interview for you all today. So please, amigos, stay tuned. This is probably, I think, one of the most important shows we've done in terms of content. They're all important, but I think today has a very special tone to it. So, amigos, please stay tuned. Before we proceed with today's theme, though, I would like just to mention that today is also a very special day in Costa Rica. Today, Costa Ricans are celebrating the 72nd anniversary of the abolition of the army in Costa Rica. So Costa Rica hasn't had any army for 72 years. That is something that is quite spectacular. And at some point, we're going to be doing a special show only on that very specific subject. So the celebration is actually tomorrow, December 1st. But today, the celebrations have started. A lot of Costa Ricans are on holidays, and there's some celebrations around the country. And here's a photo that we've gotten out of the archives for you all. This is Presidente Jose Figueres Ferrer, who 72 years ago was hammering, I guess, the walls of the military barracks here in Costa Rica. And ever since then, Costa Rica hasn't had an army and has lived peacefully ever since. So, amigos, we want to remind everyone also that our show is interactive. If there's anybody joining us for the first time, remember, you could ask us some questions. You can make some comments. You could ask some very specific questions or a very specific special guest that we're going to have here today. So you just make your comments in the live section of your Facebook or in the live chat section of our YouTube channel, and we will make sure that we could actually invite our guests to respond to your questions. Today, amigos, we are going to be talking about COVID, and I know we hear a lot about it all over the medias, all over the news, every channel. So we talk about, COVID and COVID all around the world. But today we're going to be talking about COVID when traveling, and COVID when traveling to a country like Costa Rica, because now the holiday season is coming, vacation time is coming, and it's a very, very important topic. And with our very special guests today, we will be talking about the COVID situation in Costa Rica and certain of the areas, but we will also try to present to you all some very specific tips about how you could enjoy your holiday and be the safest possible. And amigos, I need to say that this subject today is very close to my heart for a number of reasons, but I just want to introduce or start the show with a very personal testimony. About 3 weeks ago, I had a friend who came in from North America. He was very happy to arrive in Costa Rica. He was very happy to drop by for 10 minutes and say hello. Very happy to drop by for a few minutes, bring us a little gift. We invited him in our house, and we had a good discussion. We talked about changing the world, and then he left. And then the next day, we went to visit some other friends here in Playa del Coco, went for dinner, had a great conversation, talking about changing the world, and all of a sudden, my phone rings. It's my friend. And he's saying, Pepito, I'm feeling very bad. I am almost convinced I've got COVID. Can you help me? Where do I go? What do I do? Pause. So I refer him to the Coco Medical Clinic, to send him for a test. The next morning he has a test. Calls me back 36 hours later. Pepito, I've got some bad news. I tested positive. So that really hits you, I think, when a situation like that is getting so close. So this very bad virus that was all around the world, in China, in Italy, in Europe, in Canada, in the States, it's all in San Jose. All of a sudden, this virus was in my house, was with my family. And maybe I'm contaminated also. So a new reality kicks in. Maybe a little bit of preoccupation, a certain amount of panic. Yeah, I'm feeling good, I'm healthy, but who knows? So me and Carolyn, we go for a test also to the Coco Medical Clinic. Within 36 hours, we get the results. Negative. Thank God. Thank God we tested negative. But the outcome could have been totally different. So, I mean, we are working publicly, we are working in tourism, and we have always taken this virus and this very bad situation very seriously, and trying to do a whole bunch of things to keep safe and prevent from getting this virus. And we don't go in huge gatherings. There's a whole bunch of things. We always apply social distancing. We wear the mask. We have everything. But all of a sudden, we let our guards down for 10 minutes. Casual friend comes in, says hello, give him a glass of water, gives us a gift, and all of a sudden, your world can change. So this is one of the reasons why I think it's a very important topic. So people coming, for holidays to Costa Rica, or people living in Costa Rica, I want to share my experience, my feedback, and the very special guest that we have today. I think we've got one of the best persons in Costa Rica, one of the best persons in Guanacaste to talk with us about this subject today. And we would like to welcome to the show our dear friend, Dr. Hanzel Larios. Welcome to the show, Doctor. You have a lot of applause. Okay, I think your mic is muted. Here you are. Okay, hang on here. Okay.
Now.
Yes, we can hear you. Perfecto.
Hello, Pepito. First of all, I want to say thank you for inviting me to your show. I know that it's very important to talk about this topic in these days, because as you said on your testimony, we saw this in the distance in China, Europe, United States, San Jose, but now it's here in our town. So it's important to talk about this, because this is a reality and we have to continue. We don't have to have fear. We have to continue with our lives, but we have to take some measures and some new behaviors and avoid some of our social behaviors too. But we will talk about this. Thank you for the invitation, my friend.
And yes, I think it's important to talk about it. So during the show, I'm going to give you an opportunity in a minute to sort of like introduce yourself, explain very briefly what you do so people could understand. Then what we are going to do, actually, we're going to be talking about, we're going to try to give some very practical tips to people who are actually planning or already in Costa Rica on holiday. a lot of it are just common sense things, but we've compiled a little list. I think this is the first time this list is going to be published. And just to give some people some pointers and some little tips and tricks. And then we're also going to talk a little bit in the end about the clinic, and if people need to access your service, exactly how they could do it. And in between, with Telicino, our friend, and he is going to see if we have some interesting questions or comments that are brought into us by the people watching at home, and YouTube also. And if so, by all means, amigos watching, if you have any questions, if you have any comments, don't be shy. I am reminding everyone to do it via the chat channel of either YouTube or even Facebook. Dr. Hanzel Larios, can you give us a little bit of an idea, people who don't know you, who you are?
Okay. Well, my name is Hanzel Larios, as you said. I'm a general physician. I'm originally from San Jose, from Tibas. It's a small town where is the best team of soccer in Costa Rica, Saprissa. Obviously, I go with Saprissa all the time. I decided to come and live in Guanacaste. If you live in Costa Rica, probably the best option is Guanacaste. So even that I'm from San Jose, I decided to move here in 2004, I think. I came and did part of my training, the last 3 months of my training when I was in the med school in Liberia Hospital. After that, I met a good friend, the ER doctor there. And when the project of Four Seasons start to build, they invite me to come and join to the team and work as a doctor. I had been before that in the emergency room, working on the emergency rooms in Quepos, another beautiful area in Costa Rica. That was almost 17 years ago. So I came to Guanacaste, first to Liberia. Then I opened a private practice in a little town named Guardia. And then I met my beautiful wife on 2000. I have to say good, okay, 2008, more or less, right? And she's a dentist, and that's why I met her. She wants to come and open a clinic in this area, and that's how we met. And we decided to come to Coco and open a medical office and a dental clinic. So we joined efforts, and we started with a small office. Now we have a clinic, and we have this clinic. We have another by Pinilla, another in Quepos, and we're still working a lot to give the best service to the community.
Excellent. Now, amigo, before we get more into the tips, and I know there's a lot of people watching today and are wondering, they have their tickets ready for Costa Rica, are looking forward in coming down. I don't want to get into the Ministry of Immigration requirements about Costa Rica. I really want to keep on the issue of COVID and the content of the issues and the safety and the health perspective. Could you give us a little bit of an insight in terms of what is the actual situation with COVID in Costa Rica, and then maybe a little bit more into certain areas like Playa del Coco, Liberia, or Nicoya, things like that?
Okay. Yes. In our country, we start with the first case in March. Remember that this disease starts in December last year in Wuhan, China. From there, it goes at the beginning to Europe, and from there it goes to United States at the beginning. And in the case of Costa Rica, the first case was diagnosed in March. So that was a little bit good for our country because we had time to prepare, to get equipment, to get protocols in the hospitals, to prepare the people with education about which are the measures to prevent. So I think that was very important. That's why Costa Rica had a very good position to treat this. By the moment that we have the first case, I think that the government did a very good job um, trying to contend and to delay the arriving of the condition in Costa Rica, the disease in Costa Rica. We knew since the beginning that we will have it eventually, but we want to delay it to prepare the doctors, to prepare the hospitals, the nurses, to get equipment. Um, Costa Rica has a very good health system. That's one of the things that we are very proud. The other thing is that we don't have army, as you say, and we are
Mhm.
celebrating that. But that gave Costa Rica the opportunity to prepare. Um, and that's since that moment until today, according with the report of the Ministry of Health, we have a little bit less of 140,000 cases total. From those,
140,000. Okay.
yeah, and from those, around 50,000 cases are active and in the country. And in Guanacaste, that is where we live, more or less it's around 3,000. In our community in Carrillo, it's around 200. Still, this is not a lot compared with other places, but as you say, it's maybe 3 4 weeks ago we even think that this is happening, but not to us. But now it's in our community, and we have to learn and continue. Um, as I told you, it's not a thing of to have fear. No, it's about learn how we have to live. It's about
That's right.
solidarity, not just with our family, with the old people, with the people who has more risk. That's what we have to do right now, my friend.
Hmm. And we also know that one of the requirements until about maybe 3 weeks ago or a month ago to come to Costa Rica was to actually have passed a COVID test before. Now, that requirement from the government has been dropped, and that has changed, and I guess to encourage tourism. So now people can come to Costa Rica in a much easier fashion, which means that the discussion we're going to have today, the preventive elements of visiting a country, is even therefore even more important. Do you think so?
Well, yes, the government decided to remove that requirement like 3 weeks ago or a little bit more. But by the moment when they decide to remove this, it's because we had the cases of COVID in Costa Rica in a number that we already have community transmission, especially in San Jose, not in our community by that moment. So there was not point to require this when we already have it in the house, right? So and another of the situations with this new condition, this new disease, is the impact in the economy, and we cannot. Costa Rica is not a rich country, so there is a lot of people suffering because the economy. So I think that the government tried to put in a balance. So uh, and they delayed this until the moment that they saw that there is not a point to require this thing. There is still other places in the world where still, if you travel, you will have to get this test if you want to go back to your origin. So, if, for example, in United States, in Massachusetts, in Philadelphia, I think, in New Jersey, in New York, I know that they require that if you let the state and you're going to go back, you have to do it. So, and this is changing. This is dynamic because as we have it 4 weeks ago, and now we don't have it. That can change. So one of the things in order to prepare to travel is check with your local government which are the rules to travel.
Absolutely. So now, Dr. Hanzel, let's get into some of these practical tips right away. I will put them on the screen here, and then I will invite you to maybe make some comments. And I've put this one first here, probably based on my my own personal experience recently. And I put this here because I think so many things are related to that. Is like, be smart about what you do, and think about the kind of context or the kind of situation you are putting yourself in.
Totally agree. For example, I used to the people who knows me, not in the office, not in the clinic, my friends, they know that I like to go to have a dinner, to sometimes go and chill out with them. But now it's a little bit different. We have to be more cautions with it. We have to have precautions with these things right now in these days. I still, for example, I go to some restaurants because I want to support the economy too. But I pick where I want to go. And I not just for me. I'm worried. I'm a father and a very proud father. So as doctor, we are very, very close to that. If I ask somebody in the audience if you saw somebody dies, usually you are gonna say no. But as doctors, we are close to this, so we know that this is part of our lives. But we need to be smart. So I don't want to expose to something if I don't have to do it, right? And that is the way we have to think in these days. Everything changed. That's the reality, and it's in our community, not just here. It's all around the world. So we have to learn to live with this.
Absolutely. Okay, so now I'm gonna go to the next one. The next one is about like inviting people to like prepare a little kit before they actually leave for their trip. So to make sure that they do have the supplies in mask, or they do have the supplies in gel. They do have like some wipes, even maybe a thermometer, and maybe even the medicine that they will need for the time of their stay. Because we know, especially people visiting Costa Rica, some regions of Costa Rica don't have all the infrastructure, are further away from centers, or further away from pharmacies, or further away from some of the services. And if you all of a sudden you don't feel well, then and you're feeling really, really bad, so what do? So plan accordingly.
Exactly. As you say, we need to have a plan. In these days when we are going to travel, or always, but especially in these days when we are going to travel, we need to have a list of the things that we need to travel safety. The mask, the gel, the thermometer, as is in the list, are very, very important. We must be careful in the places where we are gonna be close to more people, like in the airports. Wear all the time the mask. Don't touch your face. It's not just wear the mask, because sometimes we wear the mask, but at the end of the day, when we are gonna remove it, we do a mistake and we touch without clean our hands before we touch our face. So we must be careful with this. The other thing that is very important to include in this first tip is the insurance. Actually, in Costa Rica right now, it's a requirement to have an insurance that covers COVID-19 disease treatment. If in the website, the official website of the Institute of Tourism of Costa Rica. There is a list of companies that are approved in Costa Rica, but those are not the only ones. The important thing here is that you be sure that your insurance will cover COVID expenses related. Expenses related with COVID-19 disease. And that's very important because, and for example, you say there is some places in Costa Rica where the access to facilities maybe are not so easy. So probably it's not a good idea this year go to those places. Maybe in other times, but as you say, be smart.
Be
Have a
smart.
plan.
That's
Exactly.
right. We do have a question from Budarte that says, do you think we have the COVID test at some point done with saliva? Maybe you want to explain how the COVID test is done now. We're skipping a little bit forward, but we'll come back to some more practical tips after, but we'll take the time to answer Budarte's question.
We have like three different kind of tests. We have the PCR test that detects the RNA of the virus. This is like the official one to do the diagnosis, and it's the one that almost all the states and countries requires because are probably the most sensitive tests, and it's exactly the one that you have there is the one that we uh, take a sample from the nose and we detect part of the RNA of the virus. And these are the ones that we require to do a diagnosis. And these are the ones that almost all the countries require. The countries who has this rule, this is the one that they need. There is another one that is what they call the rapid test is the saliva. It's not available yet in Costa Rica. It detects the antigen of the virus, not the ADN or RNA is the antigen of the virus, but it's not available yet in Costa Rica. And there is another one that is the ones who detects the antibody, the antibodies that our body creates to fight against the virus. And that works very good to know if you were exposed to the virus, not to know if you have an active condition. And it's very important to know, for example, there is some patients that I think that I had it. So probably the PCR is not the best in that case. Probably it's the blood test. And it's a blood test. It's not a sample from your nose. It's a blood test and you can get it right away the same day. The other one that is from the nose, usually it takes between 48 to 72 hours to get the results.
You see, in my case, was about 36 hours. And so I'm going to proceed with another little tip. This is just for some people who are traveling. Sounds very simple. People are spending time in the airplane. Bring your pillow and bring your blanket. Try to prevent using stuff that may have been handled by a lot of other people.
Yeah, well, I think it's a good tip. Yeah, definitely. And one of the things that the air flight companies are doing in these days, everything changed, Pepito. So they put a lot of filters in the air conditioning in the airports. They in the airplanes there is new technology and of course if they don't do this they will be out of the market. You will not fly with them if they don't do this. And it's not just that they want to be competitive, it's a requirement from almost all the institutions of the authorities of health in all the countries. So but still I think it's a good tip because sometimes you will feel more comfortable with your own pill, right? Especially in these days, I think it's a good tip that you have your own things, your own mask, your own gel, just in case you want to be prepared.
Absolutely. And this one here, of course, we hear over and over and over again, but it's so important. Always maintain that distance. Always maintain that physical distance of 2 meters, 6 feet, 2 meters.
Yeah, it's very important because there is going to be situations. For example, in the restaurants. Now we go to restaurants, and when we talk, they did experiments to prove that when we talk, the droplets of saliva usually don't go more than 2 meters. And so far, what we the research says is that the transmission is through these droplets of saliva. So keep that distance is to put a shield of distance against somebody that probably can have it. And one of the important things here to remind is that around 40 or 50% of the cases, they don't have symptoms. So they will not look sick. So they will be in the restaurants, they will be in the airport, they will be in the bank, in the supermarkets, in the tours, in the bus. So we have to assume that anybody can have this. That's why we cannot, as you say, we take care of all the time, and it's just a matter of 10 minutes that we don't take all the measures, and we can get it, the condition.
Absolutely. We do have a question from Carolyn Canning. Thank you, Carolyn, for the question. What does Dr. Hansel think about being in a swimming pool with other people or in pools together?
When we talk about the water in the pool, that could be the concerns for some people. We don't have to worry because usually the pool water has a lot of chlorides. So, and the chloride is one of the things who kills the virus. But for sure, sometimes when we are in a pool, sometimes there is alcohol. Sometimes after drink 1 or 2 beers, and you are not going to be with a mask in a pool for sure. I don't imagine people with a mask in the pool. But the most important thing in a pool is to keep the distance, right? You don't have to be afraid to share the water of the pool with other people, because the virus is not going to survive in the water. But is if you are talking with somebody in the pool close, very close to you, you are on risk.
Okay. Very good question from Carolyn. Thank you, Carolyn, for the question. We talked about social distancing. Now, this is very important also. Limit contact with frequently touched surfaces.
Yeah, very important. The other day I was seeing an experiment that some doctors run in United States. And for example, when we go to the bathrooms, public bathrooms in the airport or other places, so we go to wash our hands, and sometimes we put our hands in a surface, or in the restaurants, or in a bar, in the bar of the bars. So as I told you, it's not just wear the mask, it's wash your hands, because always we are touching things. And for the owners of the restaurants or the offices, or any place, we have to clean very often the surface. So it's very important that we try to not touch, and try to clean it as much as we can.
Mm-hmm. Very, very, very good tip indeed. And what do you think about, like, somebody was asking a question about, like, going to restaurants? Any practical tips for going to restaurants? Maybe like check if they have like protocols in place, or
Yes, that's a very important question, Pepito. For example, I know that when we do a reservation in a restaurant, sometimes we ask if they have an option like gluten-free options, because I'm not good with gluten. So, or somebody in our family have problems with gluten, or somebody just is a vegetarian. So we, before go to the restaurant, we call and we ask about these things. Well, now we have to ask about the protocols, That's something that um, definitely I will not risk my family going to a place that doesn't have the all the controls and protocols with their employees, and with not just with their employees, with their clients. Because if there is a client who is not respecting the protocols, is going to put on risk the clients, the other clients, and the staff. And there is many studies that says that we have to favor the outdoor restaurants and bars, because as we explained, the droplets um, are in the air. So if we are in a place where it's closed, it's an indoor place with the air conditioning, with many people talking without a mask, there is, of course, an increase on the risk to catch the virus in that area. So the recommendation for these indoor restaurants, because I don't want that they lose their clients neither, they have to be prepared. Like they, when we go to the airplanes, they put new systems in the air conditioning with ultraviolet light or with ozone to clear 99% the air in these areas. But if the restaurant doesn't have this, I will advise you to go to outdoor restaurants and bars for sure.
Excellent. And of course, always wear your mask wherever you go all the time. People hear that all the time.
Yeah, and that is a very important, because not just with the mask, it doesn't mean that you cannot catch the virus, but there is some studies that suggest that if I catch the virus from somebody who cough, for example, and cough without a mask, and I don't have a mask, the charge of the virus on the inoculation at that moment is gonna be higher than if you had a mask and I have a mask and you cough, you have the virus. I maybe will get the virus, but the charge of the inoculation at that moment is gonna be very, very, very low. So the chance that I get a severe disease is lower. And that is part of the explanations why the mortality and lethality of this virus is lower in these days than at the beginning. If you remind, in February we saw what happened in Spain, what happened in Italy, a lot of people dying. Doctors has to make decisions who is going to survive. All these ugly things. Many factors happen. We didn't know. People didn't use the mask. They didn't follow the recommendations. We were not prepared at that moment. So Costa Rica, we were lucky that the virus doesn't start here. So we have more time to prepare, and not just in that, to educate the people about the measures. And now we have more treatments available, that we understand better how this virus affects our body, and we know how to treat it. So even if you get it, first of all, 50% will have not symptoms. So we don't have to be afraid of this. But even if you catch it, in these days, we know how to treat it. The important thing here is to test as soon as possible for two things. First of all, because we don't want that you continue with your normal life. We want that you make a quarantine to try to avoid the transmission. That's the number one. And number two, if we know that you have the virus, we will be able to follow you on a treatment, to give you the treatment with the proper time, with a proper timing, in order that you avoid all the complications that we already know that this virus can develop.
Perfecto. And here's another very common sense tip. cover your cough and sneezes.
Yeah, definitely. That's something that not just with this virus, this is education, right? If we are gonna cough, we have to cover. That's what our moms teach us since when we are kids. So especially these days, we have to be careful. And if you have any symptoms, don't go outside. Don't go talk with your. I'm sure that if you call to your boss and says, "Look, I'm having fever," he was going to say, "Go to the doctor and don't come back. Don't come to the office because you are going to put on risk your partners and the clients." And
Exactly.
if I'm a tourist, if I'm traveling and I get sick, as I told you before, it's a thing of responsibility for my health and for the other ones. I don't want to expose anybody to this condition. We have to be responsible of our actions too.
You're so right. I want to remind everyone watching, if they do have any questions or comments during the show, by all means, amigo, you're invited to make them via the chat section, either in the Facebook section or the YouTube our YouTube channel, and we will present the questions to our special guests. We do have a comment and a question here. This one is pretty practical. Also, it's very interesting. What Carolyn Canning says is that, like, shopping around in grocery stores around Christmas time, especially now in the beach towns in Costa Rica, where everybody's coming to the beaches, and there's a lot of people in the aisle, so it's very difficult to do social distancing, right?
Yeah, and that's where the protocols has to have very strict application. It's not just we were talking about go to a restaurant. The same going to a grocery store. If you go to a grocery store where they are not following the protocols, it's not just have the protocol. The protocol is a piece of paper. The important thing here is that we follow the protocol. Everybody has a mask. Everybody has to wash their hands before go. And more, very important, everybody have to keep the distance. I know that here in town there is some of the supermarkets where I go. They are doing a very good work because they have to handle this. As you say, there is a lot of customers, and sometimes even when, for example, I know one of the supermarkets here in town that one of the things that they say, you cannot come with your couple or you cannot come with your kids, and that's true. It's better. Why you are gonna go with your kids to the market in these times? It's better to leave the kid in the house because they will touch everything. They will not understand. I have a 3 years old kid that who loves to go to the supermarket because for them it's like an adventure. But this is not the time to go with your kids to the
Exactly.
supermarket. And it's a very good question.
Comes back
We
to our
have,
tip number one. Yeah, be smart about
yeah,
it.
be smart about it. Yeah.
Be smart about it. Thank you again, Carolyn Canning, for the question. What does Dr. Hansel think about being in swimming pools? We've covered that one before. How do we cope? Hang on here. Gemma Harworth, how do we cope with people on the beach? Where will there be restrictions? Um,
Well, the same. At least here in Costa Rica, we don't. The government what did they give a special schedule to go to the beach. But if you go to the beach and there is a group of people not following any precautions, and they are coming to you, as we say, we have to be smart. So
yeah.
we have to avoid these situations. Look for maybe. I talked with a friend today. He's from Canada. He comes every month, every winter in Canada, every summer here because he's a little bit old. He's 82, and and he told me, you know, Doc, I will be here 4 months, but I know that this area, Coco Beach, is very popular in December. So I will try to avoid the restaurants, and I will try to avoid the supermarkets because there is too many people in town. And he doesn't talk about if people is following or not the protocols. He says that he will not going to expose himself because he knows that he is on risk, and be smart, as you say. So I told, yeah, exactly, that's what you have to do. Order, we have delivery service, we have we can cook at home, uh, or we can go to the restaurants where we know that they are following the proper protocols. There are supermarkets where we know that they are very strict with the protocols. That's to protect us. So we have to pick these places.
Mhm. And a question now from Mary Sweener. First of all, both my husband and myself would like to recommend Coco Medical and Dental Clinic for everyone. We've moved here 2 years ago. We are Canadians, and your medical office has provided both my husband and myself with the best care.
Thank you so much, Mary and Terry. I know you very well. They are very good customers. We really thank you for your words.
Thank you for the comment. And thank you, Gemma, also for the comment. Now, let's talk a little bit about lodging. People are coming to Costa Rica. They're looking for a condominium. They're looking for a place to stay. They're looking for a hotel. Once again, I'm going to put this one here on the screen right now because I find this one really, really interesting and quite important. That maybe it's something people don't think about at times when they actually arrive to their holiday, to their hotel, is to check the vacancy between the rentals. So, I mean, is somebody going to be leaving the condominium or the room at like noon and you're going to be entering at 1 o'clock? So that is a question that I think needs to be asked to the establishments. Is there a cleaning schedule? How does that work? And I think you have a little personal, I think, example maybe to share in regards to that.
Yeah, definitely. Everything changed. So in the past, I remember that you can schedule a room in a hotel or a house in Airbnb or other website, um, and it doesn't matter if they do the checkout, early checkout in the morning, and you do early check-in in the afternoon, same day. But everything changed now. The cleaning process of these places is going to take more time. We have to clean all the surface. We have to, and probably, in my opinion, for example, in my clinic, we see patients. So, and I don't know if they are with COVID or not. What I know is that I have to guarantee my clients that they will not catch anything here. So we have awesome machines to guarantee to clean all the air always, all the time. We have ultraviolet machines to put it during the night because you cannot be exposed to this, to clean every night the clinic. The same with the hotels, with the rooms. Our renter has to guarantee us that they are doing the cleaning in the proper way. So for sure, that's something that you have to include in the questions that you are going to ask when you are going to book a place. It's a good one, Pepito. Thank you.
Yes, and I think it comes down to once again like common sense and being smart about it, but also I think like each person taking the time individually to making the proper inquirements, and I think asking the right questions to any service provider that you will encounter during your trip or your vacation.
Yeah, exactly. Be smart, and it's good that you start with this because right now, and it's not just, for example, with the rooms in the transportation, as you said. So How often do you clean the microbus or
Yeah,
your car?
absolutely. Here's a
Yeah.
question from Alain Boucher. What about gyms? Gyms in Coco or gyms anywhere else? What is your perspective on that?
It's the same. Everything changed. In the past, a gym was like a place to exercise and to socialize. In these days, and we are sweating all the time, and always we have been when we go to the gym, we want to clean everything. But now, what we are doing here in Costa Rica, and it's a rule from the government, is that you have to schedule an appointment to go to the gym. The capacity is, I think, 50%, and they have to be very strict with the cleaning, always, but especially in these moments. So if you are gonna go to a gym, check out that they are doing the proper cleaning process
Mhm.
in order to reduce the risk that you get this.
Absolutely. And here's another question from Alain in the same perspective. At the gym, if I clean all bars and dumbbells, does it does it make it safer?
Yeah, of course. We have to clean it all the time before use it. And as you say, bring our gel, bring our everything. Because if I will go to the gym, and you know what? What happened in these days, Pepito, it's that a lot of people start to do training in their homes. I hear
Mhm.
that one of the business that never that in these times they make a lot of money is the people who sells the equipment. I'm not saying that you cannot go to the gym. I'm saying that if you want to go to the gym, be sure that your gym follow all the protocols, that they clean, that they have all the materials to clean, that even you can do before to be sure that you can go and clean with alcohol. And as we say, chloride, alcohol, those substances are going to kill the virus for sure.
Absolutely. And in the same spirit, we run a tour company here in Playa del Coco. Um, and we are fully legal, we are fully registered, and the Institute of Tourism has provided us with a list of protocols. I know a lot of people come on holiday, it's the same thing, public transportation. Um, People want to do tours, people want to visit the country once again, is once again do it in a very, very smart way. One of the things I encourage to people is I know there's a lot of people at times they want to visit the country, they're going to ask maybe like an uncertified tour operator or a friend of a friend of a friend to give him transportation to the airport or somewhere. The fact is that when you are soliciting that kind of service, you're not exactly sure who you're dealing with and in what kind of situation you're going to be put in from a health perspective. So just like the hotels, just like the restaurants, if you want to solicit some public transportation and tours, once again do your homework and call those tour operators or those tour agencies to see the protocols that they will have in place.
You know, that's very important. As you say, the Institute of Tourism, and not just the institute, even the private companies in this area have been working since March, since the when the government decided to close the borders, and they start to work in the protocols. How are we going to reactivate the tourism? And we know that this activity is very important in Costa Rica. It's very important in Guanacaste. So we have months getting prepared, and it's very important that you look for a company with all these certifications to give you the safety that you know that they will doing the proper things for your safety.
Yes, and absolutely. And I know one of the things that we do is it's not part of the official protocols, but we do take the frontal temperature of everyone who is entering uh, our vehicles, our buses, our vans during the tours. And this is so important, I think, in Guanacaste because it's so warm here at times, and people don't know. I'm feeling warm, feeling very hot. Do I really have like temperature, or I'm just like being warm because it's 95 degrees outside?
And that's true. And usually, people think that because everything is hot outside, we can have fever, but that's not true. You can be in a desert and your temperature body, you're gonna sweat a lot to regulate your temperature, and that's why we sweat a lot. But our temperature has to be less than 100 Fahrenheit or less than 38 Celsius grades. And the question here, Pepito, is what I'm gonna do if I have a customer with fever. So you have
Mhm.
to have your protocol doesn't go cannot just go to say, okay, we're gonna measure the temperature. No, what I'm gonna do with my client when he has fever, that I
Yes,
have a plan to refer him, and it has to be like mandatory. Okay, you cannot go with us today. We can arrange an appointment with at the doctor, because you don't want to put the other clients on risk, and you don't want to
absolutely.
put the and we have to be very responsible. It's not like I'm gonna talking about experience with the booking. One of my friends, a colleague from San Jose, he wants to come to Guanacaste to rent a house for like 6, 7 nights, luxury home. And the owners told me, "Look, Hansel, we have a problem because he wants the date when they want to come. I have the checkout the same day, and we have to respect our new protocol of cleaning." So they refused this booking, and they lose that week. And that was probably in September when people more need reservations because this was very very low. But they decide to not rent because they didn't have enough time to clean properly, and that has to be the responsible way to go in these situations. If I have a client with fever, he cannot go to the tour. If I have to pay back the money of tour, I will pay back the money of the tour. We
Yeah.
have to be responsible.
Absolutely, and we have to work collectively on this. Well, I know that one of the things that one of our policies that we're putting into place for the upcoming season is all of our tours this year are going to be either private or semi-private, and we're really encouraging people to, even though sometimes could be a little bit more expensive, but to inquire about actually doing a private tour with your family or your social bubble as opposed to going in a group. But and the tours we're going to be doing this year is it's going to either going to be private or semi-private, no more than 4, 5, 6 people, with some distancing, of course, in the vehicles and all the protocols we have in place. Mary has another comment here. Will expats be expedient status be offered the vaccine here in Costa Rica? Can we pay for the vaccine whenever it comes?
Okay, about the vaccination. Fortunately, we hear the news: Moderna, Pfizer, AstraZeneca, and well, there will be more. It's more than 100 options. We will have it eventually, and the government guarantee for the Social Security 1.5 million of vaccines from Pfizer company. So those we go to the public, through the public system of health, through the caja, for the people who is going to have more risk, especially well, health workers, people with diabetes, old people. Those are going to have the priority. But it doesn't mean that the vaccination is not going to be available in the private pharmacies. I'm sure that the vaccine is going to be available to if you want to buy it in the private pharmacies. The government just guarantee this because they want to put these vaccinations to the people on risk. So, and
Mhm.
Costa Rica, it's 5 million people. So it's more or less a 25% what we will start with this amount for the population. But the people who, if you're a tourist, if you're an expat living here, but you are not a full permanent resident, I think that you will be able to get it to Costa Rica in private medicine. And I think another thing here that the rules to become um a resident or is one of the projects in our country that I know that they are working on this is to I don't know how to say it, but to reduce all the requirements in order to try to bring more people expats because I hear that the process is not easy to become a resident, but I think that the government is working on that too. So that's a good news.
Perfecto. Telecino, do we have any other questions or comments for the time being? Uh, while we are reviewing that, okay, I know that quarantine is no more necessary, but friends are coming. This is a very good question. This weekend from Canada, should I wait the 10 days before doing things with them? So I'm already in Costa Rica. I have some friends that are coming down. How do I, because they haven't passed a COVID test, um, what is the best way to protect myself? Very good question.
Very good question, and the answer for Alan is you have to take precautions with everybody because not just with your friends coming from other country, even people here in town, you will see people that looks healthy and they can have the virus. So probably you can see them since the first day, but with all the measures to protect yourself and your family. So
Mhm.
if you're gonna have a dinner with them or something like that, keep your distance. We are human beings. We have to socialize for sure.
Yes,
But
yes,
in these days, everything changed. So the
yeah.
way how we are gonna socialize is different. So
Remember that 10 minute.
yeah. The answer is you don't need to wait 7 days. You need to follow all the measures with everybody.
Mhm. And like the comment we had on the screen before, don't let your guards down. Always be cautious and always be doing things smartly. There was another comment there, Telecino. I think it had to do with hospital. How about the accessibility of the medical services and hospitals?
Okay, Costa Rica has, as I told you, very good health system. Everybody will have access to social security, and the government for the tourists requires that they get an insurance, but they guarantee that they will have access to the hospitals. And we have private and public medicine in Costa Rica, so you can have access for both.
Mhm. And so that's a very, very good question. Let's go see in some of the tips that we have here also is I have this one here. Um, Now we're going to get more, a little bit of, I'm going to ask you a little bit more about testing. But one of the things we talked about yesterday, and I thought it was a really interesting tip from your behalf, is that before you actually go somewhere, for example, and like, yes, Playa del Coco, and there's some communities where there's some infrastructure, there's some clinics, there's some hospitals and stuff, but there's some communities where there's not a hell of a lot there. So before you leave and before you decide you're going to go and spend 2 weeks in some isolated area, do your homework, do your research, bring your proper supplies. And one of the things you mentioned yesterday was know where and how you could get testing done if you need to do that quickly.
Yeah, that's something that you have to consider. If you are in San Jose, you will be able to get the PCR test probably Monday to Saturday. Outside of San Jose, probably just in some areas you will be able to get it. Not all the touristic areas, and sometimes because the way you have to do this test is just a few labs in Costa Rica where you can do it, and all of them are in San Jose. So we have to take the sample early in the morning, transport the sample in a specific car with a specific temperature. So it takes time. Sometimes I have some clients that they say, look, Hansel, I can pay more. It's not a matter of money. Even if you pay, you will have to wait between 24 hours to 72 hours to get this. Monday to Friday, if you do the test on Friday, probably you will get the results on Monday or Tuesday. And that's something that you have to consider if you are traveling or if you have customers and you want to advise them how to schedule the flights. If they require this test, that's something that you have to consider, the schedules to do the test and where are you going to do it if it's available. Here in Coco, in our clinic, is available.
Absolutely. And I know from experience. I think we've covered a lot of the practical points. I'm going to check with Telecino, see if there's more questions or comments coming. Is there, here's a question from Mary Sweener. Is your office offering tests? And if so, is it the rapid test? So here we are. She's right on line with my line of questioning also. And I'll let you answer that.
Okay, Mary, we have in Costa Rica just two kind of tests right now. The PCR test that detects the REN of the virus. That's the one that it takes between 24 hours to 72, and is the one that we use to do the diagnosis. The rapid test is the one that detects the antigen. It's not available in Costa Rica yet, and they call it rapid test because it doesn't take 24 hours to 72 hours. Usually you get it the same day, but it's not available in Costa Rica yet. I think that there is some labs that they are doing all the work that they have to do with the Ministry of Health, the license and the permissions to get it, but in Costa Rica it's not yet. I think that eventually it's going to be here. And the other one that we have is the antibody test, and we have it available here in Coco too. And you get the results the same day. But usually this works more to know if you have been exposed to the virus, not to know if you have an active condition, active disease.
Perfecto. That's great. Well, thanks, Mary, for the question. And
Yeah,
so,
thank you.
if I could resume out of all of the tips that we've mentioned, the first one is be smart, about how you plan your holiday. Another one I think is very good if we want to resume is inquire, ask the proper questions to people around you. That's also very, very, very important. And don't let your guards down. Like I remember, like you mentioned during the show, like always assume when you're with someone or in a situation that there's a potential and there's the risk that's there, without panicking, but be smart about it.
Definitely, exactly. I think that you did a very good work resuming this, and I don't want that people be afraid. We have to learn how to live with this. We have to continue with our lives, and we need to know that even if we catch this right now, there is treatments that are very effective. Costa Rica have very good health system. The important thing is that you see your doctor as soon as possible.
Mm-hmm. I know from experience, from having been exposed, that we did, as soon as we got the news, contact the Coco Medical Clinic by phone. It was 4 o'clock in the afternoon, 3 o'clock in the afternoon. By the next morning at 8 o'clock, we had an appointment. We went in, we did the tests. It was very, very well managed, very professional. We felt very safe about everything. All the staff had the proper protective gear and everything. And 36 hours later, the results came back, thank God, negative via email. And we were able to pursue with our normal life, but we had self-isolated during the entire waiting period. We put on the screen some of the ways how to contact the clinic. There's a phone number. Telisnu had it up there. And there's also a website. You also have a very active Facebook page also. Coco Medical and Dental Clinic or Center is right downtown Playa del Coco. Easy access, easy to find. And you're also part of, an entire network, I think, of medical care across Costa Rica.
Yes, Medirit.
So, I mean, the services that you are offering to people, it's top-notch facility, ambulance service.
We have dental team. We do all the dental care. We do a lot of medical specialties, gynecology, plastic surgery, dermatology. We do pre-hospital care. We do coordinations of our air ambulance and ground ambulance. So I always say my clients, I hope that you don't need anything, but if you need anything, we will be there for you. And always we try to improve, get the best technology for our clients. So we are here for you guys.
Absolutely. I know from experience. Dr. Hanzel Larios, I want to thank you for taking the opportunity and the time that you spent with us today here to share your expertise, to share your perspective, also to share your common sense, especially with a lot of people who want to come and visit Costa Rica. Everybody's anxious to come down for the holidays and for the winter months now. All of the information, all the practical tips that we actually shared with everyone today, we will actually publish in our YouTube descriptive link of the interview today, all the proper contact information, the website for the clinic, the website for the information for your Facebook page. All of that is going to be in the descriptive portion of the show on YouTube. And we want to thank you for sharing this time with us. Before we leave you, is there something that you think, one last piece of advice or something that we may have forgotten to cover that's coming to mind?
No, first of all, Pepito, I want to thank you for the space in your program. And I think that the most important thing is to remind that now the virus is in our community. And I know that we have been very relaxed about the cases number we didn't have, but now is when we have more cases, and it's when we have to continue working together without fear, just following all the protocols, putting in action what we have been working in the last months. Thank you so much for the audience, and we will share this in our website too, in our Facebook page, because I think it's very important information. Thank you for the space, my friend.
Okay, thank you very kindly for spending some time with us. Okay, and we will do another interview soon and talk a little bit more in depth about all the different important services you're offering at the clinic. So there's an invitation out there for you.
Thank you, my friend.
Thank you. Okay, thank you, amigo. And so here we are, amigos. So that was Dr. Hanzel Larios talking to us today from the Coco Medical and Dental Center here in Playa del Coco. We want to thank everyone for the opportunity to have spent this time with us. We want to thank everyone who's presented us with some questions and some comments. We want to thank Telisnu for his great work. Aplauso for Telisnu. And amigos, please, amigos, be safe, be smart, enjoy your holiday, and we'll talk to you soon on one of our next interviews at Pepito Live Costa Rica. Thank you.